Good afternoon. My name is Brian Blase. I appreciate everyone being here today, especially with the British monarchy trying to steal public attention. I'm the president of Paragon Health Institute, and on behalf of our entire team, it is my pleasure to introduce you to the National Press Club. There is no more fitting venue for a conversation like this one than the National Press Club. For more than a century, this institution has been a place where consequential ideas are debated, where policymakers are held accountable, and where the press and the public pursue the truth. It is a place that stands for open and respectful dialogue, and that is precisely the spirit we hope to embody here today. At Paragon, we believe in a patient-driven healthcare system that delivers affordable and high-quality care. We also believe that government healthcare programs need to be accountable and sustainable. That conviction brings us together today. Medicare and Medicaid are among the most important federal programs. Unfortunately, waste, fraud, and abuse represent a sizable share of these programs, with bad actors enriching themselves at taxpayer expense and harming those who most need them. Over the past few months, the American people have seen national headlines and stories of waste, fraud, and abuse nearly every week. From Minnesota to Florida, California to New York, the scale of the problem is staggering, with the costs of fraud reaching tens of billions of dollars each year and waste of an even greater amount. At Paragon, we've made program integrity a cornerstone of our research mission. We believe that fixing the incentives that lead to so much fraud and waste in federal health programs is not just a fiscal issue, but it's a moral issue. Every dollar lost to a fraudulent claim or improper payment is a dollar that cannot go to a patient who truly needs care. That brings us to today's discussion. We've assembled some of the most serious and committed people in Washington to combat waste, fraud, and abuse. First, we will hear from Dr. Mehmet Oz, administrator of the Centers for Medicare and Medicaid Services. He has made fighting fraud and restoring program integrity a top priority. Then, we will be joined by Demetrius Kouzoukas, who served as the principal deputy administrator for CMS from 2017 through 2021. Finally, we'll hear from two members of Congress who are leading investigations into healthcare waste, fraud, and abuse, Senator Ron Johnson and Representative John Joyce. Let's begin. It is my distinct pleasure to introduce Dr. Mehmet Oz, 17th administrator at CMS. He oversees programs that account for roughly 30% of the federal budget. He is a professor emeritus at New York Presbyterian Columbia Medical Center and has won 9 Daytime Emmy Awards. Dr. Oz received his undergraduate degree from Harvard University and obtained a joint MD and MBA from the University of Pennsylvania School of Medicine and Wharton Business School. And he is the author of 8 New York Times bestsellers. We are truly grateful to have him here, and we applaud his leadership. Please welcome to the stage Dr. Oz.
Very kind. Thank you. I hope someone recorded that for my mom. That would have been nice, that just a little gift.
Hey, thank you for doing this today. It's really a privilege to have the opportunity to speak with you. It's a little intimidating learning that you won 9 Daytime Emmys to be in this position.
You made the first strategic move correctly. Oprah always sat on that side. And I'll tell you the reason. And that's why, Bobby, if you look at every host, they always sit here. Because the stage exit was behind your back there, and she didn't like the shoes were tight. She didn't like the way they fit, so she would just walk out barefooted, put the shoes on, sit there because it was closer. It made everything more seamless. But that little maneuver allowed you to have the power position now. So I'm the guest.
Well, I'm glad something that Oprah and I have in common.
Yes.
So we know where to sit on the stage. Thanks for all you're doing as head of CMS. As head of CMS, you oversee Medicare, Medicaid, the Affordable Care Act. These programs serve tens of millions of Americans. Each year, more than $2 trillion flows through these programs. And unfortunately, too much of the spending is characterized by waste, fraud, and abuse. What have you learned about the magnitude of the problem?
Let's put the context that folks can actually apply to their life, which is the lens of affordability. So how many folks are still working in the room? Put your hands up. Most folks. So if you're working, there's a pretty good chance that you're worried that Medicare, this beautiful crown jewel of our social support system, may not be there for you when you retire. So what funds Medicare, the hospital part of it, is Medicare Part A, and that trust fund is going to expire in 2031. If we were to address the fraud just in Medicare, I'm not even talking about the rest of the system, which we'll get to, but just in Medicare, it would double the life expectancy of the Medicare Trust Fund. Double the number of years that Medicare would guarantee be there for you, so that when you work your whole life, you'll be caught by the system that you're funding, that 3% you take out of your paycheck every month, every week, that's going towards Medicare and the trust fund. And so those are the kinds of numbers that when people hear them, they say, well, it's impossible. How can you have that much fraud? It's about $100 billion, we believe, of fraud, waste, and abuse. I'm going to put them together because they actually interplay a fair amount. The problem with fraud, the reason it's so corrosive, is it corrupts the very foundation of the system. It's not just the numbers and the dollars, and we're going to get into that because this is the world expert I'm sitting next to. And I actually desperately tried to recruit Brian into the government, and he said, I'll be more helpful to you outside. And he sent me great people. He let me hire some of his best staff, and I thank you forever for that.
You're very welcome.
It's been, we can't build a winning team without having draft picks, and you gave me a couple, and thank you. And it is the biggest surprise in my whole experience in government is the quality of the people that actually want to come in and serve. And many of you, and I come to these events to recruit people. You, a spouse, a relative, someone you care about, someone you know might want to come serve, and this is a great administration participating because it's a generational opportunity to address some of the problems we're going to review today. But specifically with regard to fraud, a lot of people don't appreciate that when you take a system like, take hospice, where we've been pretty active of late, you have 1/3 of all hospices in the entire country in the city of Los Angeles. Not the state, the city of Los Angeles. There's not that many people dying in Los Angeles. So there's something clearly wrong. So the clues were there. The question is, why weren't they addressed? And we can get into the details of what went down because I think they're important. But I want to challenge you up front, and I want you to think about this entire conversation. Is it really a flaw that we have this much fraud in healthcare? Or is it a feature for some people? Like what's going on in California, there's actually problems we have in New York State with personal care services, same kinds of things. Take the personal care service issue because it's one that's becoming louder and louder. The number one job in New York State is to be a personal care service provider, which means you're carrying the groceries upstairs for somebody or you're driving them to the doctor's office. When it becomes the number one job in the state and it's funded by the federal government, and it's becoming a jobs program that the state doesn't have to pay for, at least wholly. And then add to that, layer on top of that, the reality that a lot of these folks who are on Medicaid, by law, and this is historically, the law is not new, it's been there for decades, you have to also give them access to voting. So now you're actually recruiting voters. And then you add one more layer to that, which is the unions can now come in, potentially, and this is actively occurring, we believe, and try to unionize these groups. Now you have an entity which historically has been supportive to one side of the political spectrum, now getting funding from unionizing as many people as they currently have in their union. And you're starting to see a broader tapestry of political patronage that is very concerning to anyone who just wants the healthcare system to be healthy. And we're often accused of all kinds of falsities, but there's, in my opinion, no better program out there to help Americans than Medicare. It is truly a safety net that helps everyone feel comfortable as they work through their lives. But Medicaid, likewise, is the payer of last resort. When you have fallen and you can't get up, it's the program that's there for you. It has to stay viable. And I believe the president saved Medicaid and Congress through actions on the Working Families Tax Cut legislation, which you are a world expert on. Some of your research was very informative to us as we were trying to figure out exactly how the Working Families Tax Cut legislation would help states and the federal government align better to make sure that Medicaid patients were well taken care of. But I want you to keep that in mind. These are difficult decisions to make. It's easy to vilify people for trying to fix the problems. If it was easy to address the underlying issues, we wouldn't be here today. And maybe this wouldn't have been as big a problem if it wasn't for COVID, which we'll speak to later on. But COVID changed the entire dynamic. COVID taught a lot of bad people that you can steal from the federal government and you can get away with it.
So you mentioned affordability, so the fraud and waste makes the healthcare less affordable, and then clearly the public corruption is something that Americans see, and it's enormously frustrating when you have somebody who goes to work, pays their taxes, plays by the rules, and they can see how easy it is to manipulate these government programs and enrich themselves. But you've made a really big point of emphasizing that the fraud and abuse really harms the patient too. So could you talk about the harm to the patient?
Well, if you're a scoundrel that's willing to steal from people in their most vulnerable moments, you'll steal their health. You'll steal their lives. And we see this happening in all the instances that I'll cover today, because these folks corrupt our expectations, but they also corrupt the people taking care of these individuals. Take hospice. In Los Angeles right now, there's a culture where doctors know there's a black market for allowing their licenses to be used to sign people up for hospice, claiming that they're going to die in 6 months, which has generally been the rule, knowing that they're not going to die in 6 months from any predictable reason. I mean, frankly, these hospices have survival rates better than this room. And that's a problem, because I'm not paying $6,000 per each of you per month to keep you alive, or at least take care of you while you're dying. And when you see these kinds of problems happening, then you realize that doctors and nurses participating in these programs have sold their souls. And then you start to see what's happening in New York, where with these personal care services, again, these are services that your family used to provide for you. One of your kids would carry the groceries upstairs. Now we're paying the neighbor's kid to do it, and maybe your kid's being paid by the neighbor, but well, the state's paying, but they're getting the benefits. And then you start to realize that they have built these social adult daycare centers, which is a place where older people can come together and be in community and spend time supporting each other. That sounds pretty good, right? Historically, humans always had places where the older folks would come together. But in the social adult daycare centers in Flushing, Queens, which is run by, we believe, by Chinese mafia and other, maybe even Chinese government involvement, we're now starting to realize that these are actually places where you congregate individuals to educate them about how to con the system. And they buy their Medicare beneficiary numbers. Remember, there's 68 million Americans with MBIs, Medicare beneficiary numbers. Those are credit cards, basically. And they buy them, they say, I'll pay you money. In return, let me use your card to sign you up for that home care that you don't really need, but it's, I'm paying you. So accept it. We're going to send home care to you every single day. And then I'm also going to send you medications you don't need, expensive prescription medications from branded products, because that way there's more profit in the system. The pharmacist gets involved. This is the corruption I'm speaking about. Then I'm going to send you to the acupuncturist, literally, and a rehab program that you don't need, and a couple x-rays that don't benefit you. All this gets paid for through Medicaid, and I'm buying your MBI number, your credit card number, in order to allow me to use it. So when the feds come after you, you don't speak. Now, that's not a theoretical, everything I'm describing I've witnessed personally, or interviewed people who've told me about. So when I go to the Southern District in Manhattan, you know what they say? There is no way for us to crack the code here through traditional law enforcement, because this is a very well-oiled network. And the rules that govern it are so poorly written. Some of that's on us, by the way. We write bad rules, like guardrails for Medicaid. People will take advantage of those weak guardrails, and we're not letting law enforcement help us. And that starts, again, build into an expectation, a normalization, Brian, that what I'm describing is how it's going to be. When 20% of Medicare, or rather Medicaid, becomes a personal care service or softer services, then it's a problem, because CMS was built and designed to audit hernia operations. Did the operation take place? Was there a licensed doctor? Did the hospital have a review process that was appropriate? Did the nurse get her degree? I mean, all the things you would know, and plus you've got a scar, right? I know what happened. Yeah. Not true for the softer services that we have to provide at some level, but they're prone to fraud, And that's why you're seeing something today in Minnesota. The DOJ took action and has taken a bunch of fraudsters off the streets. And so, again, now at this point, we have criminal charges against people involved in fraud. But it's an all-of-government approach. And what the president said in the State of the Union address when he appointed the vice president to lead the task force, he wanted an all-of-government approach. So now when CMS identifies numbers, or we get clues from the Department of Justice or the Office of Inspector General that these are bad apples, we will suspend payments. They will start taking proactive investigatory ventures. Yesterday in Los Angeles, we worked over the weekend. I got the first phone call literally as I was, arriving at home after the White House Correspondents' Dinner violence. All that stuff was taking place over the weekend to provide enough evidence for the U.S. Attorney Billy Asali in Los Angeles to take money away out of a bank account of people who are defrauding hospice. It's really hard to do that. It's gotten to the point where we're now literally confiscating bank accounts or arresting people in their facilities. And the SWAT team's effort that we had in Minnesota was in Los Angeles, the same thing. You need everybody involved, everyone pulling the oars. And I'll tell you, the big gun is forensic accounting. It's not the low-life doctors stealing money here and there, being paid off. Who's actually organizing this whole endeavor? Who are the people who are making the big dollars? And those are the folks now that we're identifying and going after. Because we have now support of Treasury, and their tools are significant in this regard.
So there's so many underlying problems, and the history, like the structure of Medicare is a pay and chase type of structure, and then with Medicaid, you have the states involved too, and the federal government providing an open-ended reimbursement of state spending. There's so much that you just said I want to unpack. So let's start with hospice. CMS has taken action working with other governmental partners to shut down hospices. How many have been shut down in Los Angeles County?
450 in California.
450 in California.
Most of them in Los Angeles, and that number is growing quickly. And we'll release updated numbers within the week. But the reality is that the best way for CMS to do things is at scale. You mentioned we're spending, it's $1.8 trillion just for Medicare and Medicaid. We have hundreds of million more for the ACA, et cetera. So it gets to the number that you highlighted. When you have that kind of money passing through our system, we can't do one-off little things. We have to actually figure out what are the red flags that help us identify where the bad people are and take them out in a large enough number that it actually moves the needle. So that 450 hospices that we've shut down to date represents about $600 million in billing this year.
How many of those 450 hospices appealed?
Well, the initial group, they didn't appeal at all. We're now starting, as we get more and more and pick up our speed, we're starting to see people call in. But I just look at the first complaint, and there's no way we're giving that money back. I mean, there's so many red flags just with that one entity that I think they're testing to see how serious we are. Look, there are going to be cases where they unfortunately meet a lot of the criteria for fraud, and they don't actually engage in fraud. I can imagine a scenario where that happens. But if you have 3 strikes, we will think you're out until you prove to us that you're not. And I'll give you a hard example. So I mentioned sarcastically about the fact that their actuarial survival rates are greater than this room's. There are some types of hospice that specialize in Alzheimer's. Well, patients with Alzheimer's don't predictably die in 6 months. Some will, and you don't put them in hospice till they're at the end of their life. So the numbers should be meaningful. But you could imagine a rare time when, for whatever reason, this 6-month window, no one really had a serious crisis. It's just highly unlikely. Then you combine that with you have a doctor authenticating your patients who's working at 25 other hospices, which is what happened in the case I'm talking about. And then you add to that, they're co-located in a building with dozens of other hospices. I mean, after a while, you're starting to realize there's a pattern here that's not a healthy one. I also want to send a very clear message, and this is a very important part of the president's agenda here, is make it clear to folks you're serious about these problems. If you're thinking of defrauding the American people in California by starting a scam hospice center, where last year you were almost guaranteed to be fined because nobody was actually paying attention, right? The last administration, you're not going to go there. But you know what you're going to do? You're going to open up a hospice in Texas. And I'll tell you right here, I'll break news for you, we're going to go to Texas. Look at hospice there, because we see it increasing. And I bet you those same scumbags that are in California defrauding the American people, they know how to drive to Texas, and they know this. They're going to rinse and repeat the same model. They got away with it with California. We already know in Nevada, I went to visit Nevada, they have 7 times more hospices there than they had 5 years ago. Again, is that a plausible increase in hospice care? And I like hospice. I think it's a very wise, mature program for us to have. I was just with Tom Scully, who served in my seat 25 years ago. He helped start hospice and mature it in this country. Done correctly, it's great. And I'll tell you who our biggest allies are: the legitimate providers. Yeah. Because they're getting hurt badly. We have ACOs who are providing affordable, these accountable care organizations, they're at risk. If we don't clean up fraud, they get taken advantage of. So they don't want to be in value-based systems anymore because we're not letting them actually extract value by taking better care of patients. So the degree of corruption that I'm speaking to is not just about a couple bad apples. This changes the entire dynamic of how we provide health care in America, and it hurts our ability to do mature things like provide care guidance, care navigation, do better. The reason all these programs exist, for example, in New York, is they want to get seniors to stay at home, not go to a nursing home. So they're good ideas, very poorly executed.
So we know spending in Medicaid, in the ACA, soared during the Biden administration. We didn't hear a lot about their efforts to go after waste, fraud, and abuse. What was the situation that you inherited? What was the state of the CMS's program integrity efforts?
See how diplomatic he was there? This is unfortunate because I
was watching Oprah.
Yes, exactly.
To prepare for this.
I love my agency. It's the best job I've ever had, and because of those people. And you walk through the halls, the average person at CMS can get paid twice as much money on the outside. They come into CMS to do something they feel deeply in their soul to be important, to make healthcare better in America. And we're talking about actuarial experts, insurance, folks who just, this is not partisan. They're just trying to make a difference for a lot of people. They were told not to pursue these issues because the number one metric of success was enrolling more people. Enrolling appropriate people is a worthy endeavor for the system. But you've done some of the pioneering work in the Affordable Care Act. This is a program, whether you like it or not, created 15 years ago, designed to provide a buffer between people on Medicaid and those entering into the commercial health insurance space. Again, noble idea. If you're sitting around the faculty lounge, you could nod your head and, with your tweed jacket having your pipe, and it would make sense, right? That stated, when you actually try to effect change, you have to be very careful about untoward influences. And one thing I've learned just in my own life, but I see it very clearly at CMS, is there second degree and third degree effects, ripples of all your decisions. So with the ACA, there was a desire to increase enrollment. It was a program that used to have 10, 12 million people in it 5 years ago. And when you throw money at it and you stop doing any program integrity, in other words, double checking if people are making the right amount of money to be eligible to be in the program, then you start to have people defraud the program. And one of the biggest risks is a zero premium policy. If you're not paying anything for something, you don't actually know that you even have that thing. And so a lot of individuals, and we're talking about billions of dollars of fraud here, didn't realize they were in an ACA in multiple states. We probably had maybe you guys estimate 1.6 million, I think it's the right number, were enrolled in the ACA and Medicaid in the same state. We had lots of examples of people who didn't even know they had the insurance. More than a third of people right now who have the ACA never filed a claim. It's highly unusual. So it speaks to the fact that there is massive fraud. And the right number of people who actually need ACA and are earning the income that makes them eligible for the ACA is dramatically lower than the number today that's currently thought to be on the ACA. Maybe it's a little bit more than it was 5, 6, 10 years ago, but it's not massively more than it used to be. There are not any seismic shifts that would explain that. So when we look at these numbers, and you've done some pioneering work at looking at what percentage of people registered and receiving free health insurance. That's what it is. You're giving somebody free health insurance, whether they're somebody on Medicaid who's able-bodied and could work, but for whatever reason can't get a job, or you're taking someone and giving them a $0 premium program. In the ACA, you are giving them a free insurance program that many of you have to pay for, and you know it can be expensive. So when done correctly, fine, it's great. But if you're getting a zero premium program and you don't even know you have it, it's a problem. And so there's research that Brian has done, and we've seen other evidence of it as well, is if you've got 5 times more people registered for an Obamacare insurance policy than make that much money in the state, what is going on? And we're talking about fraud. We've had more convictions of ACA fraud in Florida, I think, than any other state. You lead the league. And so we start to see that these bad guys coalesce, they trade ideas, they are able to figure a way of defrauding the system, they share the wisdom, and then you start to see broader infestation, which is why we have got to come in quickly and aggressively and start taking action. If you do it subtly, you don't send a clear message. And again, I'm a surgeon. I like using a scalpel. But there are sometimes you have to use a meat cleaver because the whole system is in such shock that you need to be able to fix it.
I mean, there's been 3 major Department of Justice convictions in the state of Florida. There's a lot of enrollment fraud, and we look at the incentives, and the zero premium plans give incentives to the enrollment intermediary and the insurer. The insurer likes when the government is paying 100% of the premium, and then they're getting enrolled by brokers. And every month that the individual is enrolled, the insurer is cutting a check to the brokers. So there's been some of these very large-scale fraud schemes to manipulate homeless individuals, people who are mentally ill, advertise things like cash and gift cards in order to get people enrolled in this coverage. And to your point, it is corruption. I mean, we have allowed the incentives from these programs to allow bad actors to defraud the American taxpayer and harm the people that most need these programs and protect resources for them.
And they sneak in between the cracks and crevices of the spaces between the federal government and state government. When you realize that, then you don't think of the states as your enemy. They have their own set of headaches and weaknesses, but we've got to figure out how to close these holes more effectively. And if the federal government's weak on this, the states will make money, actually. So it's not that they want to take your money, but if they're thoughtful and they understand there's an opportunity, they'll take it because it's easier for us to print money than for them to balance their budget. And we see that in many examples. But like I'll use just our examples. CMS has our Medicaid fraud team, 6 people. Used to be 80, 6 people when we came in. So it was gutted. It wasn't really a desire to do it, and more importantly, you don't want people in a job where they might do something you don't want them to do. And so these are programmatic decisions. They're not accidents. So you have to actually, in your own mind, decide, was this a good or a bad thing? Would I want my federal government doing that? Because it sends a message to the states as well, which is, again, I'll come back to working families tax cut legislation. And I think we're going to talk about provider taxes. So
I'd love to.
We'll get to it because this is an area that Brian and Paragon are real experts in. But these are legal money laundering, completely legal. If you were a governor, you would do this. It's the federal government saying, take advantage of me in any way you can, and if you don't, and the other states do, your taxpayers are paying money to the other states. And guess who the varsity team is in provider taxes? States like California, New York, Massachusetts, they're just better at it. They've got very smart people who know how to play the game. And you've got a lot of other states, by the way, blue states, New Mexico, they're not the best at provider taxes. So they didn't get they didn't get their varsity letter on that. So they end up having to pay extra money in order to support other states around them who are just more efficient.
Yeah. Okay. So let's spend some time talking about Medicaid. So at the core of the Medicaid financing, and this is just to educate the audience, you have the open-ended federal reimbursement. So states spend money, and the federal government pays states a certain amount. The more states spend, the more money they get from the federal government. And one of the things that surprises a lot of people is that states don't actually need to have a real expenditure. And they collude with providers like big hospital systems and the provider tax mechanism. The hospital system often develops it, will go to the state and say, well, tax me $1 million. Then the state spends that $1 million back on the hospital. That's just an accounting gimmick. But then they invoice that $1 million to you, and the average state has 70% reimbursement. So that fictional transaction nets the state $700,000 that then they share on the hospital with the hospital system. And what we saw was the growth in this, what we think is corporate welfare through these state-directed payments. Massive increases to big, politically powerful hospitals. And this is not fraud in the sense of the hospice case or the autism case where you don't get services provided, but it is clearly, we call it legalized money laundering. It's clearly an abuse of the way the Medicaid program was supposed to be designed. You were so effective at communicating this issue with provider taxes and state-directed payments, and we got those major reforms in the One Big Beautiful Bill. So I thank you for your leadership. You were really the most articulate person in the country at explaining that to key policymakers. But what did you learn through this process of the federal-state relationship and the amount, I think you said if the state-directed payments continued on their current course, it would take over all of CMS's budget?
If we had not intervened, the state-directed payments would have generated, with the provider taxes, about $5.4 trillion in additional expenditures. Just to go it again, these numbers are so big you can't fathom them. Our current budget is under $2 trillion. Over 10 years, not 1 year, but over 10 years, it's $5.4 trillion, so an extra $500 billion a year on top of our budget. That's just to keep up what was happening. And we saw a run in the bank. As soon as states and the consultants and people involved in this process recognized that there was going to be an issue with legislation, they immediately began submitting these applications for state-directed payments and waivers to be able to do these provider taxes. But I want to take, again, a step back. This is not just about the specifics of what I'm talking about. The deeper reality is you're corrupting the foundation of the system. If the state knows that 70% of the money total, all in, if its expenditures on Medicaid comes from the federal government, they still have 30% they have to put in. That keeps them a little bit honest. If they can change that number and make it 80% or higher, now they have less and less incentive to care. In fact, quite the opposite. They want to spend money because that's money coming to their state. Remember, all that money, it goes to taxes and highly skilled individuals who pay taxes and brings new businesses in. So it's actually them sucking from the federal government for their state at the expense of other states. So now you have the 50 states fighting each other to cheat the government. And the better cheaters get more money. So you're rewarding bad behavior. Soon, no one's on the same team. Everyone's gaming it. I can come up with every scheme you can imagine because I've heard them all. There are states that expanded Medicaid, never spent a penny. There are states that are been able to over and over again get much more money you could ever imagine giving them for services. We see schemes where they will pay ambulance drivers who are working in one system a lot more than a regular ambulance driver would ever get. And that other ambulance driver therefore doesn't get paid anything in that same village or town. And so these try to pervert the system in ways that have unpredictable consequences, but they're all bad. Our government was built on the belief that a governor and a president should be directionally aligned. We should be heading in the same way. Right? If we're going to bring industry to America, we all benefit. When we do the most favored nation drug pricing, which we've been very successful at, the president insisted on it, he's absolutely right. Americans pay 3 times more on average for the same drug made in the same facility, even in this country, than they pay in Europe. I was this morning, I was at the White House for the welcoming for King Charles. The first country that said, all right, enough, because we were pressuring all the countries, saying, you have to pay more because we're not going to keep paying 3 times more than you. And we want to protect innovation. So yes, drug companies take a haircut, but it's also not fair for you to freeload off America. Global freeloading will fail. The UK was the first country to agree to increase, the first time in 25 years they've done it, a significant increase in their payment so that we can pay less. So it's at least a fair and balanced place. Guess who benefits from that? states, because we dropped the money first for the states so that they can afford to buy medications for their Medicaid population. That's how government should work. The president negotiates something, it benefits all the states equally, everyone high fives, and we go on because we're on the same team. You don't have a football team when all the players are paid differently if they do different things, especially if they hurt their opponents. That's what we functionally have created with some of these schemes. That stated, I really feel confident now. We've dealt with the majority of those problems. We have a fraud task force that is broadly an all-of-government approach, where we have Treasury helping us with their tools, and we've got DOJ doing and U.S. attorneys doing a great job, and going after bad guys. And now Medicare and Medicaid, we've hired up a lot of people. When we came in, we also had 9 engineers. You can't run an agency of this big with 9 engineers, so we're staffing up. We have funding and support from the president and I think broadly across government to update our fundamental billing system in Medicare, which was built in 1979. Who can program in COBOL here? You have a job immediately. One guy, too. I mean, immediately. I can't find any engineer. So we're changing all that. It's going to be a cloud-based system. We'll be able to use AI to look at all the claims. Every state says, please help us with our data collection because we can't keep up. We're going to help them with that. We have the funding now to start this process. So remember, the states aren't doing this on purpose oftentimes. They're way in over their head on some of these issues, and they get lobbied very aggressively. And so sometimes it's easier for us to be the bad guys and go in there and say, no mas, we're not going to let that happen anymore. You have to have guardrails. Here's what they look like. Here's the best practice. This is what everyone else is doing. Because if you don't realize that your state's way over here, payments, I mean, New York State is so far off the graph on per resident Medicaid payments. If the average person in New York realized that they're paying that much more than everybody else, they would definitely be upset about it. They don't know. How many of you know what your state is in general in terms of your Medicaid payments per capita? Most of us don't keep track of that stuff, but why not? I mean, we are all Americans. We're all, Homo sapiens. Mammalian species have similar kinds of medical expenses. And there should be some relative balance on this stuff.
We have really good Paragon data and figures to illustrate state differences across the Medicaid program. And some states like California, New York, I mean, Medicaid, it was designed as a safety net welfare program, and California and New York, 4 in 10 residents of those states are on the Medicaid program. In large part in New York, the personal care service program is subject to so much abuse. And I really like, it is like the states, it's the incentives that they face. And if they get a consultant that comes in and the hospital that comes in and says, we have this great idea, we can make more money and the state can be held harmless from the transaction, that's going to get receptive ears.
You would do it. Every one of you would do it. It's like an IQ test. You'd all do it, which is, again, the unfortunate reality is it's a tempting opportunity. People did do it.
Unfortunately, the reconciliation bill, the one big beautiful bill, it froze states so they can't have new provider taxes. It lowered the amount that states can raise through provider taxes, and then it capped this corporate welfare payments. Yep. You have a 50-state strategy on Medicaid. You sent a letter to governors last week. Mm-hmm. Why'd you send that letter, and what information are you looking for?
So I mentioned earlier that they were pretty good at auditing hernias. Everyone's licensed. What about all the people who are not formally licensed, who don't have national provider numbers, MPI numbers? The reality is that states recognize there's fraud there, but they haven't really taken it seriously in many instances. So we sent a letter out last week, this again with the task force, asking every single governor within 10 days to let us know, would they be willing to revalidate these individuals, especially the ones who don't have MPI numbers. What that means is, have they gone to jail? Do you know who they really are? Do they even exist? Do they have the license to do what they say they're going to do? Basic quality control. And this is something that actually you could take your arms and put it around, and that's not daunting. Just, do you know who your team members are? And so we've sent them to all the states with the hope that all 50 will say yes in 10 days. Over the next 30 days, we want them to come up with a basic plan of how they're going to chunk this to do it. And then they have 2 years to to actually do what they're promising to do in the next 30 days. We think it's a very reasonable, it's bold, I agree. Like many things we do, it's loud. People recognize that we're asking them to do something that takes them out of their normal daily process, but we're in an urgent situation and you never want to waste a crisis. So this is a good opportunity for states to stand up, and I'm seeing it. I see governors all the time say, you know what, I'll take your deal and I'll raise you. Look at what happened in Florida. We went to Florida, your home state, and Bobby, can I have please stand up. I have Brian's wife here. Please stand. This is why he didn't come to work for me. He used her name in vain and said she wouldn't let him move to Washington. In any case, so I went I've been to Florida a bunch. Went down, saw a lot of the home health care issues. Realized it was a problem. We did a national moratorium so that these scoundrels could not run out of Florida to other states. But we did it for Medicare because we don't control Medicaid. We control Medicare. And so when we did this, we went down to Florida and said, we're going to audit you. We got to do da-da-da-da, give them a whole list. And Governor DeSantis, God bless him, said, you know what? I'm going to raise you. I want hospice moratorium, durable medical equipment supplier moratorium also in Medicaid, which we granted immediately. And we think governors will do that. I'm hearing, even from governors in blue states, that maybe this isn't the worst thing for us to be putting a little pressure. It lets them take action maybe they wanted to take anyway, and it's awkward and difficult, and there's lots of people saying you can't, go that direction. But they know they have to do it for the fiscal responsibility that they've inherited with the job, and they want their states to do well. So long term, this might give them the excuse to call us the bad guys and take action, which I'm fine with. But I just want people to head in the right direction as they do that.
Let me ask one more question on Medicaid. So this really came into the public mindset because of Minnesota, the daycare scandals in Minnesota, the autism scandals in Minnesota, and you've taken action in Minnesota, which is pretty unique to what CMS does. So CMS historically can do audits, can make disallowances, but you did a withholding in Minnesota. Can you talk about the approach in Minnesota and how you're using that to ensure state compliance?
So it's called a deferment because we audit what the state has given us as their fiscal accounting for the last quarter. And we can look through those numbers and say, wait a minute, these don't add up. Or give us the backup to these bills. We don't understand why it's so much in this area and it used to be a much lower number. And we did that in Minnesota, and it was not a satisfactory audit. We wrote a letter to the state informing them of the specific things that we were worried about. And we did not pay them about $250 million for that audit. Now, Minnesota, thank goodness, has a rainy day fund. We do not want the people in Minnesota hurt, but we also want the government in Minnesota taking this seriously. And we know there's significant fraud in the state. The state knows that as well. So now they're going through their books and going to try to figure out why is it that these numbers don't seem to work out quite as right, and what can they do to fix it in the future. We did this because we are given the right to protect you, the taxpayer. It's our obligation, we feel, to not only audit what's happening, but stop paying if we think it's fraudulent. Because if the money leaves the building, we don't get it back. I've seen this again and again. You get these convictions, but whatever money left the door before you got the conviction, it's often the Cayman Islands or back in Russia. I was part of a big and wonderful orchestrated Department of Justice effort. They combined all federal law enforcement, had FBI and OIG, Office of Inspector General, all these guys were there. And some of the biggest perpetrators had been able to not only escape the country, back in this case to Russia, but they took about $2.9 billion with them. So I just don't want the money leaving the building. With the hospices in California, we're not allowed to shut down a hospice. I can stop paying a hospice. And when you stop paying people, if they're not legitimate providers, they tend to just go away. But the state has to shut them down. We have some authority, but it's a long investigation. It requires other. My main power, my main lever arm is I don't have to pay the bill. And so if I use that appropriately, not abusively, but appropriately, and with good justification, and there's a lot of rules around these things, because historically CMS has never used these powers. But we do have the ability to get you to look up from what you're doing and pay attention to us, which is the whole hope of many of these actions.
I want to ask one more question about Medicare. And it's an issue that you heard a lot about in the fall, skin substitutes. So can you walk through what you learned about skin substitutes and then the action that CMS took on this?
This is a cautionary tale. And I'll warn you ahead of time, what we did was pretty aggressive, but it is what we're going to do when we find these kinds of scenarios going forward. How many of you know what a skin substitute is? Good number. But very succinctly, for the half that didn't put their hands up, something the size of my thumbnail, basically a postage stamp, made of some material that mimics your skin. Good scientists come up with good ideas. It's not a very sophisticated concept, and they cost about $30 a postage stamp in Europe. $30. In America, many times they're $5,000. You might say $5,000, a lot more than $30. In Europe, they just buy this postage stamp, the government does, and you use it. In America, we pay the doctor 6% of the purchase price. Don't ask me why, but that's the rule. So if it's 6% of the purchase price, the more a vendor can increase the price, the more you get paid if you're the doctor. And the doctors who don't have, again, a soul will take advantage of the system and begin to use these inappropriately. I mean, a lot more than you'd ever think of using. We got bills for one poor lady in a nursing home just before she died, had $1 million of skin substitutes implanted on her body. And you know, I have to pay it. It's a legitimate bill. The price is legitimate. The person putting it on was legitimate. I cannot stop it. And those kinds of things are infuriating. This business was $250 million 5 years ago, before COVID. Again, COVID woke people up. They realized they could steal. No one's going to come after them. No one's enforcing the law. So this $250 million cottage industry grew last year to $15 billion. It was going to be $25 billion. It doesn't grow 10% a year. It's growing at 50, 60, 70% a year, because as fast as you can defraud people, you can get into the business. And these folks are very, very savvy. So they began to create probably the largest lobbying effort of its kind ever. They just hammer us, carpet bomb us. We're providing challenges to seniors in nursing homes, you know, not giving them access to care, hurting the industry. And what I said to everybody in the industry is, you watch this neighborhood go to pot. You watch the weeds come up, the toxins evolve, the entire place fell apart. And you were in the industry. And when good people don't say things, bad stuff happens. So don't blame me. I'm doing what I was brought here to do, which is to deal with a corruption that I think is, at this point, almost irredeemable. Now, there are still good people in the skin sub business, but so much of it wasn't that we made a pretty aggressive stance on reducing payment to what we thought was a number that everyone should be able to live with, which is $125. It's still 4 times more than Europe, but it's not $5,000. Now, of course, everyone's upset because guess what happened when the price went down? Utilization dropped. Because if I'm not bribing you to put it in, you're not going to put it in. So now they're complaining that, yeah, we dropped the price. Maybe they can live with that, but no one's using them anymore. That's not a flaw. That's actually evidence that it was being overused. And I think that's one of the realities when you have a system that's gone down. So if you happen to be in any of these industries or you have friends, please, if they're legitimate providers, have them speak up now. We're getting help, for example, from the home health care organization. They came to us and pleaded saying, we're being suffocated because there's all the increase, 10% increase year over year in home health care, but all that money is going to California. So they're saying, help us, because they're sucking up all the money. The rest of us are actually hurting financially. That's good news for me. I can now use that evidence, because you also know where the bodies are buried, and make an inroad. The legitimate hospice providers. Many of the hospice providers outside of California are horrified what they're seeing to the legitimate people inside of California. The legitimate people want us to do this. They want to take the bad guys out because the bad guys don't provide services. They just cheat. So if you get the bad guys out of the way, the good guys have a healthier marketplace. So it's actually a very healthy ecosystem if someone is watching the till. If no one's paying attention to the bank accounts, then it actually, you're actively aiding bad apples.
What you did on skin substitutes was a major achievement, and you and CMS, the administration, deserve a lot of credit. You know, when CBO looks at estimating the budget, they think that your skin substitute policies reduced Medicare spending by $250 billion over the next decade. If it was on that trajectory, $250 billion might be, so it is, and that translates into real benefit for American seniors who pay more than $100 a year in lower Part B premiums because of the action to address that That's
Well, I tell you, again, I want to credit the people who are really involved. First of all, the team at CMS, I haven't mentioned their names much, but Kim Brandt, Chief Operating Officer, was primarily responsible for this. Dan Brillman, Caprice Knapp, running Medicaid, jumped in on over this. And we have a wonderful team now that's been involved in, Chris Klump runs Medicare, John Brooks on General Policy. These guys just buckled down, but every one of the people I just mentioned got lobbied. And you know who got lobbied the most? The president. And what the president said? I don't care. Do what's right. Literally. And they got, it came down Susie Wiles, right up and down the administration. They were getting lobbied because this is big money. If you have a $25 billion a year business with very limited cost of goods sold, you're not going to let that go. You're willing to put extra money into lobbying to get what you want because the whole business is dependent on lobbying. And you saw what happened when the lobbying failed and appropriate prices were brought, not draconian, appropriate prices were brought into the market. The desire for these products went down dramatically. And I see that happening in other areas as well. But you need someone to be able to build a team that can identify the problems, and then you need a White House that is taking action. And you notice we're not getting called for congressional oversights. I mean, folks in Congress know it's true too. This is a bipartisan issue. Democrats and Republicans, for different reasons maybe, but they both care about this problem and they both want it to stop. It's embarrassing to Democrats, it infuriates Republicans.
So I'll ask you one final question, but you are probably the most lobbied man in Washington, and CMS, because of primarily the Medicare program and just the reimbursements and how much of commercial payment is linked to what Medicare does. You have lobbyists all the time. Healthcare lobbying now exceeds lobbying in the defense industry by a factor of 6.
Is that right?
Yes.
I'm calling Hexeth.
And
I had no idea.
And the American taxpayer and patient don't have lobbyists. So I really appreciate what you are doing to represent the interests of the American patient and the hardworking American that's financing the programs. So last question, I guess anything that you want to close with. Congress is considering another reconciliation bill. They're looking at fraud. Are there any additional tools that they could arm you with that would be helpful in what you're doing to try to target waste, fraud, and abuse? Particularly with respect to maybe artificial intelligence, but go ahead and close.
First of all, you hosted beautifully. Congratulations.
Thank you.
Thank you.
That means a lot coming from you. I mean, when I read today 9 daytime Emmys, it was a little intimidating. So,
some of the things I can't talk about directly because we're in the middle of discussions with Congress, and I don't want to. You don't want to front run Congress. These are smart people with very smart staffs, and they have a good idea of the kinds of things we need. Some of these are powers that allow us to take quicker action. Some of them would stifle growth of disingenuous providers without hurting appropriate providers. That's the balancing act. You want to let legitimate people prosper and grow while at the same time providing them some air cover so that bad apples don't come in there at the same time. But there's one sort of bigger idea that I'd like to leave you with. CMS, although we are regulators, and we therefore have to call balls and strikes and make some decisions, we have also, because we're continuing paying money out, we have the ability to use a different power that's not actually present in other parts of government as much, which is the power to convene. We can pull together stakeholders in different areas who normally would not collaborate and give them safe harbor and ask them to be meek. Now, what does the word meek mean? Meek shall inherit the earth. It's sort of a phrase that used to throw me off when I was a kid because I thought meek and weak, which they rhyme, but they're not the same word. Meek means you're strong, you're powerful, you have a sword that you could use and do real damage with it. But you decide on your own accord, because you're strong enough, to sheathe your sword, put it away, and deal with some bigger issues. So we have been using the power to convene with insurance companies on prior authorization, with the tech sector, with a massive move now to getting big tech companies together. We have over 650 who've pledged to work with us in interoperability. So we have flow of information across the ecosystem so I can see perturbations like gravitational fields so I can identify fraud earlier. And when I say I, by the way, I'm thinking about the agency because obviously I can't do any of these things. But smart people know how to do these things very effectively, but they don't have people blocking and tackling for them so they can do their jobs effectively. And I think that's where Congress can really help us. If we could take, for example, the most favored nation drug pricing I mentioned earlier and codify it, which I do believe has bipartisan appeal. If we can get insurance companies to write their policies in plain English, which means getting state regulators off their back so they don't have 45-page documents and just tell you what you just bought. If we can have transparency across the board on pricing, on the things that you can pay for, so market forces can begin to influence decision-making, and that transparency is incredibly effective. In fact, TrumpRx.gov might be one of the greatest accomplishments we have because it brings transparency to the drug market. Before you buy a product in a drugstore, you should check TrumpRx.gov out. More than 10 million people have. It's a great service, and it's wonderfully effective at getting you to feel empowered. They can control your future, and that's why AI is so important. 1/3 of Americans have confidence that AI is going to be a force for good. 2/3 are scared out of their minds. And I was actually at the White House ceremony. We were waiting in the rain for the king to come out, and with the president. And so I was standing next to Jensen from NVIDIA and Tim Cook from Apple. Sounds like a joke, doesn't it? And so I was telling them both something that's a pet peeve of mine, which is there are no movies where AI is a good force. Right? In every movie you see, AI is some dystopian, destructive force that's going to take away mankind's ability to survive. Right? Just one movie where it's a good thing. And the reality is, unfortunately, most Americans have soured on the proposition that AI is important. But I'm here without any hesitation to tell you, we've got to figure AI out because it will dramatically help the healthcare system in America. So much of what we need to do to keep up with just the medical advances to take care of you. If you have cancer now, I should understand your cancer genome, your microbiome. These are trillions of factors overlapping with each other. No mind can do that. And that's why only the top-tier cancer centers even keep up with this stuff. So we need it for basic medical care, but we also need to keep track of how we're doling services out. We can make instantaneous payments in the moment to hospitals and doctors, de-risking their financial, the float, giving them, therefore, clout to make immediate prior authorization decisions. I mean, imagine if healthcare system worked like the banking system, where you go and you put a card in, like many of you will do after this discussion, and you get a coffee. Seems pretty straightforward. Imagine helping in healthcare. They don't know who you are. We don't know if your card's legitimate. Every vendor's different. Every coffee's different. There's no one to actually bring it together. You can't buy coffee. You stop buying coffee. And so that's what we should be doing in healthcare. It will work. But we need the American people and the folks that influence them, including the arts, but I think Congress plays a role here too, to provide some safety, some safe corridor for AI to prosper. Because there are parts of this country where, and so help me God, I look carefully at this, we are not going to and will not have enough doctors and nurses taking care of people. In rural America is a good example. We put $50 billion in the most ambitious plan perhaps ever to help folks in rural parts of this country, 60 million people. I can't get enough people to go there and provide mental health services. But with AI, enhanced support, doctors could see many times more patients, which dramatically changes the balance of care and gives access to folks who desperately need it and to doctors and nurses who want to help. Congratulations for all you've done.
Thank you. Join me in thanking Dr. Oz.
Thank you very much. Appreciate it. Nicely done.
Thank you so much. Appreciate it. Thank you, Dr. Oz. All right. I'd now like to introduce my Paragon colleague, Demetrius Kazoukas. Demetrius, come onto the stage. Demetrius is director of Paragon's Medicare initiative. He has been with Paragon since the founding of Paragon. Nobody knows CMS and the Medicare program in the country as well as Demetrius. It's really a privilege to work with Demetrius. From 2017 through 2021, Demetrius served as the chief executive of the Medicare program at CMS. Under his leadership, CMS developed and operationalized a vision to enhance patient-driven healthcare nationwide. While at CMS, Medicare's payment error rate consistently declined. He holds a BA in political science from George Washington University and a JD from the University of Illinois College of Law. Thank you, Demetrius.
Thank you. Well, I knew not to sit in the Oprah chair.
And Dr. Oz, we went longer with Dr. Oz than I expected. So we will go shorter, you and I, reacting to Dr. Oz. And when we conclude at 2:45, we're going to have our next main panel, which is Senator Ron Johnson and Representative John Joyce. Any initial reaction to the conversation with Dr. Oz?
Yeah, it's remarkable, really, to understand the scope of the work that's been done, but also to understand that it's only a glimmer of what could and should be done, and that really they're only getting started, and that they've surfaced this much in terms of the opportunity is something that we all know, but to give it this kind of high-level impression and attention, it's remarkable to see that.
So he's got so much passion and clearly commitment to improving American healthcare, these programs being sustainable. You know better than just about anybody how hard it is to move policy changes through the massive bureaucracy at CMS. How do you think an administrator's leadership can translate in CMS priorities and day-to-day operations?
Well, it's really critical. I'd say the easy answer is it's important for a leader to state the vision, to identify it, to paint a picture of it, and to give it attention. But that's really just the starting step. There's a lot of work that Dr. Oz talked about that happens behind the scenes to implement and translate reprioritization like what he's talking about. And the fact is that the entire organization has a lot of activity always going on. And so number one is really being able to identify what it is that the agency's not going to do, making some of those hard decisions. And so in my experience, when you have a job to do that's on this kind of scale that he's talking about, what you've really got to do when you're leading a team this size is reassure them you're going to make sure that you make the decisions that create trade-offs. So when they come to you and say, well, we can't get these other 14 things that people are demanding of us done, and this other thing that you're asking us to do, you need to be able to fight for the priorities that you want, and both in terms of dollars, but also, most importantly, the time that it takes internally to develop new processes and so on. And then the other thing is revisiting settled assumptions. So, I mean, these programs have been around for decades. And so the people who've been working with them have also been around often for decades, or the institutional memory lives on. And so you come into something like this, and there's always been some decision that was made 10, 20 years ago, 5 years ago, about how something ought to be considered or settled. And you've got to be able to revisit those decisions and understand which ones have an opportunity for change. So those are two critical factors.
Have you seen the administration, any administration is focused on waste, fraud, and abuse as the current administration right now?
I've not seen this kind of high-level attention in my working history. Obviously, we kind of heard in sort of the early Reagan administration, some of the attention on fraud, waste, and abuse too. But this is a big focus and an all-of-government effort for sure.
He's an energetic CMS administrator, and Dr. Oz is very energetic, and an administration dedicated to a war on fraud. Is that enough to meaningfully reduce and address waste, fraud, and abuse in health programs?
It's a start. As energetic as any administrator can be, as talented as any team under the administrator can be, as dedicated and competent as any of the contractors and civil servants that lead the team underneath them are, it's only a start. And I'd say that because, first of all, CMS is just one piece of this. There are a number of interagency partners, DOJ, the OIG, HHS. I mean, every time you want to make, sort of a change in, literally a change in the rules, you've got to get, probably, 200 or 300 people to sign off on that. And so that means that they have to prioritize their time as well. But then there's also some deeper structural issues that just create we have a system that has essentially made fraud, waste, and abuse at some level or severe attempts at it a little bit of an inevitability. And so those have to be addressed as well.
Because the program largely exists to pay claims quickly.
Indeed. The program was set up and designed historically as a way to provide access and without limit. I mean, literally without limit, right? It's a indefinite continuing appropriation from Congress, in other words, a blank check. And that creates an incredible incentive for people to make money off the system in ways that weren't intended. Some of that is fraud, waste, abuse. Any of it is unacceptable. Too much of it is. And then some of it is also not necessarily fraud, waste, and abuse, but sort of an inefficiency that's built into a system that was designed primarily around getting money out the door.
So Dr. Oz, he talked about the problems with state incentives and Medicaid and developing these financing schemes to maximize federal dollars without states spending their own money. That's not fraud, but it is not the way the program was intended to exist. You also have the skin substitutes example, where you just had Medicare paying these outrageous list prices. And again, he said that was what they was legally required to pay, so they needed to change the payment rule. How should we think about these structural issues compared to traditional fraud schemes like just not delivering services, billing for things that are fraudulent, phantom enrollees?
I think the lesson for us from the focus on the state efforts is that these kinds of incentives are built into the system across the board. That it isn't just with respect to states, but also with respect to providers and plans and everyone else really in the system. And so there's I think a need to understand that fraud to have the kind of focus we're having on fraud today, but also to start to have a bigger conversation within the policy community and with Congress about how we create a wholly different structure, a structure that doesn't have as much of this incredible magnet of this pot of money that is literally bottomless, that draws every kind of creative way to maximize payment. And that's what happens when you have unlimited payments.
At the state level, I mean, it leads to a lot of very educated, smart people becoming consultants to figure out how to maximize federal money coming into the state without the state making their own contribution. So you have people really focused on just ripping off the federal government rather than productivity. You've been in and out of government for decades. You've seen many efforts to address waste, fraud, and abuse. What do you think are the key characteristics of more successful ones?
They avoid two particular problems. One is the problem of scale. Medicare has such a huge scale, and it doesn't have the flexibility that a normal commercial actor would have to test something in a little market somewhere. There's ways to do that, but it's just not always practical, and it takes time. And so sometimes when a new program comes online, so for example, I was in government once when we had implemented a pre-claim review, essentially a prior authorization kind of process. CMS has limited authority to do that. But when the system came online, some contractors were really good at it. Some contractors weren't as good at it. We had multiple contractors. That was a learning, but we were learning learning as it was happening. And so paying attention to how to scale and understanding how to pilot and then scale. The second is Congress. And that is that everyone loves to fight fraud and abuse, and everyone wants to save money until it comes to their backyard and their district. And then you've got members of Congress who always are complaining about, I've had these meetings with these providers in my district, and in the private sector, we call that provider abrasion, by the way. So it's not a unique thing to government. But in the private sector, those things get resolved at the end of the day because there's a limited amount of money unnecessarily coming in the door. And so someone has to figure out how to make the puts and the calls. In the government, with the way we've set up this system, it goes back to the incentives we talked about. There's always the option of just hit pause and let future taxpayers pay for it. And so because of that, it's important to really, for a administration to also work really closely with Congress to understand exactly what they need in order to be able to sustain the program.
Are you bullish on AI, and do you think AI can meaningfully address fraud and waste in these programs?
I think it's a draw. I think that AI presents many opportunities for fraud, waste, and abuse, and it also presents opportunities to catch it and prevent it. And unfortunately, I think the private sector, probably the private sector is more adept at figuring out how to make use of both sides of the equation. The government will always be, I think, a bit behind because it has a commitment and a need to operate within the rules that Dr. Oz talked about and the processes. So I get a lot of people coming to me with ideas about we can identify this or that kind of fraud or abuse, and I often sort of tell them, look, that's only a small part of the problem. CMS's problem is going and executing on the fraud and abuse and waste that it suspects or believes is happening, because the way the systems integrate, the way the data flows, the way the contractors work with each other, the kinds of appeals process that government has to offer people because it's government, it's very different than the private sector. And so it's essentially hobbled from the beginning.
So let me ask you, time for one last question. And so we've seen DME, catheter scams, skin substitutes, much bigger problem in original Medicare than managed care, than Medicare Advantage, where we have capitated payments. So can you talk about the role of managed care and capitation and outsourcing, sort of the discovery and limitation of waste, fraud, and abuse?
Well, private plans have an inherent advantage in making progress against this problem, and that is because, number one, they have networks, so they don't have to, essentially the federal government contracts with anybody who's got a valid license and not a criminal, and certain kinds of criminals, that is, not any kind. And whereas plans have flexibility to decide how to contract, and when they remove someone from their network, they don't have to go through the same kinds of appeal processes that the federal government has to, because it's not a government actor. And there's also choice between competing private plans. So they also have to make decisions that at the end of the day will still work to get them their market share. The other thing is that private plans have the ability to design their benefits and change their benefits on an annual basis without going through the same kinds of extensive review that the federal government does. And they have situational awareness faster. The government makes a rule, does it, and knows what happens at least 3 years later. You can imagine, and that's just because of the claims lag, the data, the flow, and the process. And so you can imagine the kind of opportunity that creates.
Thank you, Demetrius. All right, so we are going to move to our third panel. We're going to need to move a chair up here. Please join me in thanking Demetrius Kazukis for this conversation. Thank you. Thanks. Sorry. Our final panel is dedicated to what Congress can do to fight healthcare waste, fraud, and abuse. We are honored to have 2 members leading on this issue. Senator Ron Johnson of Wisconsin has chaired some of the most consequential oversight investigations in the Senate, and he is not shy about going where the evidence leads. Before entering public life, Senator Johnson spent 30 years building a successful plastics manufacturing business. As chairman of the Permanent Subcommittee on Investigations, Senator Johnson has been a force for accountability in federal health programs, scrutinizing improper Medicaid payments, COVID-related waste and fraud, and the billions that have slipped through the cracks of programs meant to serve the most vulnerable Americans. Our second panelist is Congressman John Joyce. For more than 2 decades, Congressman Joyce served the people of South Central Pennsylvania as a board-certified dermatologist. After completing his medical training at Johns Hopkins, Dr. Joyce returned to where he grew up to serve the people of Altoona, Pennsylvania. He serves as chairman of the House Energy and Commerce Subcommittee on Oversight and Investigations. He has been a champion for rooting out fraud and abuse in federal health programs. The panel is going to be moderated by Ryan Long, Paragon's Director of Congressional Relations and Senior Research Fellow. Ryan brings over 25 years of experience on the Hill and in health policy. Among his positions, Ryan was policy advisor and counsel to Representative Kevin McCarthy during his rise from the House Minority Leader to Speaker of the House. Please join me in welcoming to stage Senator Ron Johnson, Congressman John Joyce, and Ryan Long.
Thank you for taking the time out today. We know it's a busy schedule up on the Hill, so we'll just go in and get started. So for months now, Medicaid fraud is generating weekly headlines, cable news reports, and social media stories. For the first time in many years, it's receiving a lot of scrutiny and focus. Government healthcare programs have always been susceptible to fraud. Did the stories out of Minnesota, New York, California, and Colorado change your view about how persuasive the fraud is?
Pervasive?
Pervasive.
Yes and no. I'm not a big fan of the federal government. I come from the private sector. I know how prone government is to waste, fraud, and abuse. But what happened with the Somali fraud in Minnesota is it put the issue on everybody's radar. But now the American public is aware of it, and they're outraged by it. I mean, one of the reasons we're running $2 trillion plus deficits next 10 years. The CBO estimates $2.6 trillion in deficits over the next 10 years, debt going over $60 trillion. The reason we're doing that is there's simply not public pressure to balance our budget. And without public pressure, we're not going to do anything about it. So I think the one thing that the Somali fraud revelation disclosure has done is it's at least excited the public to do something about it, and certainly got the attention of this administration, and they're going to be carrying the heavy load here. I mean, they've got the personnel, they've got the investigatory ability that Congress simply doesn't have.
Dr. Joyce.
I feel similarly. I think that on a microcosm, I practiced medicine for 25 years, and I was peripherally aware of fraud that had occurred. Now, having been in Congress for 8 years, you'd think that that would be diminished. You wouldn't hear these anecdotal cases. Just this weekend, I had a constituent come to me and say, I received a Medicare EOB, an explanation of benefits, where I was billed over $1,400 for urinary catheters, except I don't use urinary catheters. And the doctor's name who was on there, I've never seen that doctor. So I knew on that granular level that this fraud was continuing. But what happened in Minnesota, that shone the light on it. That allowed us to recognize that there's a lot that's still going on. And serving as the subcommittee chair of Oversight and Investigations on Energy and Commerce, I thought now was the time to continue that exploration, to continue to understand how much fraud is continuing to occur in both Medicare and Medicaid.
You both mentioned the Somali fraud and estimated $9 to $18 billion in Minnesota alone. Can people really get their arms around just the magnitude of fraud in our federal health care programs?
There are a couple of different estimates. GAO estimates somewhere between $250 and $500 billion a year in fraud. We had the CEO of LexisNexis, I didn't realize they did this kind of research, came into a subcommittee hearing. They estimate about $1 trillion. That's $1 trillion out of a slightly more than $7 trillion a year budget. I mean, it's massive. And yeah, I would say, just based on the example the doctor gave, the root cause of all of this, literally, is government, but our third-party payer system. If you had to pay more of your health care directly, had catastrophic care coverage for the big issues, but you go to the doctor, those types of things, you've got to pay it out of your own pocket. You wouldn't have the capability of defrauding somebody by billing them that, again, patients never see this stuff. I mean, actually, that was a pretty unusual thing for a patient to actually look at their EOB, their insurance company's already paid for. So we have removed consumerism from healthcare. And my final comment is, as a result, there is all the incentives in our healthcare system from all the players to increase costs. I'm making a cut off it. It's like, a realtor. If they could sell a $200,000 house for $500,000, they would, because they're making a percentage off it. Every player in the healthcare system is making a cut off it, so there's not one incentive to lower costs, or quite honestly, uncover fraud.
Dr. Joyce?
I think as legislators, we have a responsibility to be guardians of the taxpayer dollar, guardians of that Medicare fund, which workers have paid in, and that payroll tax is taken out of each and every paycheck. Guardians of Medicaid, to make sure that those funds that take care of individuals with disabilities, uninsured children, women who don't have insurance during pregnancy, I think it really is an impetus right now. And what we're working to discover and continue to work together to find out how extensive that fraud is, Ryan, what next steps are necessary so we can rein that in. Because it is not an endless bucket. It is not an endless supply of funds. But the fraudsters think it is, unless we put the guardrails up. And that's what we're working to do right now.
You'd mentioned an estimate of almost $1 trillion. Now, some have downplayed the amount of fraud in our public health care programs, or that it's just an inevitable byproduct of those programs. Why should Americans care about fraud in our government programs, and what are the real-world impacts and harms that come from this type of fraud?
Because currently, we're $39 trillion in debt. When I entered Congress in 2011, we were $14.7 trillion. As I said, we're on a path over the next 10 years to increase that to $62 trillion. It's completely unsustainable. At some point in time, we'll have a debt crisis. We're already seeing that. I would call that the acute debt crisis. The chronic debt crisis we've been experiencing is just the erosion of the value of the dollar. A dollar you held at the start of this pandemic is only worth 80 cents. That's why things aren't affordable. That's not going to be repaired. I mean, that's permanent devaluation of the dollar. So to the extent that fraud could be $250 to $1 trillion is contributing to those deficits that continue to drive the debt higher, interest rates higher, bring that moment of truth, that debt crisis closer, you ought to be concerned about it. But unfortunately, most people in Washington, D.C. are just whistling by the graveyard, as is the public.
Dr. Joyce?
I think it's time that we really take that effort to touch that third rail. When you talk about fraud in Medicaid, individuals think you're looking to diminish the amount of availability to Medicaid, where exactly the converse is true. Trying to shore up that those funds are available. So when you look at governors and say, this is an opportunity to make sure that those Medicaid funds are available for those who deserve it. And that is so important. But again, it's touching the third rail because media portrays it as you're looking to diminish, to inhibit Medicaid funds for those who deserve it. And what we're trying to do right now is really shine a light so we can bring that back in so those funds are available. Touching that third rail is going to be tough, and we're facing that right now. But this is the time to do it. And shining that light and what happened in Minnesota allows individuals to realize these are outside forces that have come into play. These are individuals who are skilled at stealing money from the federal government. And I will not give a pass just because the system is large that you have to allow for a certain amount of fraud. Fraud has to end. And I think that's our responsibility in government right now.
It has a real-world impact on affordability for families and for the most vulnerable that need the Medicaid program. Senator Johnson, you held some hearings last year at the Senate Permanent Subcommittee on Investigations that examined waste, fraud, and abuse in the ACA. What would you say is the worst example of fraud in the exchanges?
The legalized fraud. Actually, that's illegal. I mean, the worst is what happened when we went to zero policy or zero premium policies. Okay, that opened up a whole new opportunity for unscrupulous brokers to sign up people without their knowledge, because it really wasn't a tax credit going to the patient. It went right to the insurance company. So the broker got their commission, and the premium went right to the insurance company. So the insurance companies were happy with it. And by the way, they know down to the percentage point. So how many people are going to actually put claims in their policies? That no claim policy doubled. So the insurance companies were actually juicing the bonuses to the brokers. They had to know full well that there's massive fraud. I know Paragon estimated about 6 million people on those exchanges that were completely fraudulent. But again, that's the illegal fraud. As bad, maybe worse, is the legal fraud. And that'd be the 9-to-1 match. That'd be provider fees and provider taxes. Understand, a provider fee, provider tax is not health care. There was a great line in the Wall Street Journal op-ed that said, when's the last time you saw American businesses come to Congress and lobby to increase their taxes? That was happening. We literally had, I won't identify the hospital, but Wisconsin's reaction to the one big beautiful bill that didn't rein that in was to go from a 1.8% provider tax up to 6%, because it's allowed. It's legalized fraud, okay? We literally had hospitals lobbying me to make sure that we would grant a waiver for Wisconsin to get it up to 6%. And here's the example the hospital used. I mean, if you do that, we'll be able to charge an additional $12 million, but we'll get reimbursed $18 million, so our hospital will net $6 million. Was that hospital administrator not understanding? You're going to increase the cost of health care to your patients by $12 million. You don't have a problem with that? The fact of the matter is, they don't.
Well, this is a little off topic, but we mentioned the Permanent Subcommittee on Investigations. Today, there was an indictment that originated with the investigative work of your subcommittee. Would you like to discuss what your committee found?
Well, first of all, I want to give a big shout out to my staff who literally found this needle in the haystack. We got a document dump of something like 115,000 pages. By the way, not from HHS or NIH. We got this from one of the universities that they were working with, providing grant money to. But in that tranche of 115,000 pages, my staff identified an email that David Morens, advisor to Fauci, wrote, and to paraphrase, said, we found a way to make FOIA-able documents disappear. And oh, by the way, people are emailing me on this subject. Don't email to my official account, email to my Gmail account. So old Dr. Morens, after two years plus of that disclosure, was arrested and indicted on conspiracy and destruction of federal records, and it's about time.
Thank you. Chairman Joyce, in January, the Energy and Commerce Committee launched an investigation into Minnesota's rampant Medicaid fraud. In March, you expanded that investigation to 10 additional states. What prompted that expansion?
Brian, in February, we had a subcommittee of the oversight convene with 4 experts on fraud. We brought in individuals who had that understanding of what was occurring in Medicare and Medicaid fraud. And upon their recommendations, we reviewed all 50 states to see where there was potential for fraud to occur. And so we put the top 10. It's not a top 10 list you want to be on, but we put the top 10 and reached out to these states to provide us with their internal audits. As we realize, Medicaid is administered by each state individually, but each state has their own capabilities of monitoring where those funds come and where those funds go. So each of those 10 states we have reached out to. This is not a partisan exercise. We have red states, we have blue states, and we have purple states. And we are cultivating that information. We want to have a data-driven report to see where we can have impact and rein in that fraud. We're still in the investigative point of this. We're coming close as we continue to see this information pour in. And this will allow us to move forward, recognizing that we can again be that responsible guardian of the taxpayer dollar. It has to start in Congress.
So the letters you sent to the states reference certain Medicaid services. Can you tell us more about those letters and why those specific services?
Certainly. Hospice services, we're all aware of what has occurred in California. And when it comes to personal care services, individuals who have someone carry the laundry to the laundromat, or someone who helps them bring groceries in. But when we see that these are the largest employers in certain states, and we see the incremental increases in employment and cost in Medicaid dollars, we have to be able to recognize why those are occurring and to make sure that they're adequately, that those jobs are being performed and not just being paid by individuals who have signed up and often not knowing what they have signed up for.
Thank you, Dr. Joyce. Senator, the SI subcommittee jurisdiction extends beyond healthcare. Are there examples of fraud outside of healthcare that you think is important to discuss? If so, what does the fraud in non-healthcare government programs tell us about the state of our government and the need for reform?
So this is where I'd go. Again, I'm sure there's illegal fraud throughout the federal government. Anytime you have a grant, you're going to have bad actors are going to take advantage of just the lack of control in federal government programs. But, Eisenhower warned us about the military-industrial complex. It's out of control. And two examples I'll use in terms of legalized fraud. Ukraine war, for example, the munition of choice is a 155 millimeter shell. Russia produces that shell for about $600 a pop. We pay $6,000 to $8,000 a pop for that exact same 155 millimeter shell. I know of an individual who ran a company, sold it to a large, one of the big contractors of the military-industrial complex. So he was selling a part to the military for $3.5 million. Sold out to, and probably got a very good multiple for the sale of his business. Exact same part, I don't think it's probably even updated. It's now being sold for $42 million. So again, that is just the gross inability of government to control spending whatsoever, or not even care about controlling spending. So I think this is widespread. Every agency, every department, every grant, everything we spend, there's going to be somebody on the take, legally or illegally.
Well, we've seen news reports of COVID-era unemployment fraud, food assistance fraud, hospice fraud in California, the daycare fraud in Minnesota that you both referenced. And who in government is responsible for weeding out the fraud? The IG, is it GAO, Congress?
I think it's a collaborative effort, Ryan. I think we have all individuals who are keenly aware of this as this has risen into the sights of what's important. I think that a point that we have not yet made in this conversation that is important, that this fraud occurs and affects, I've talked about the financial effects on Medicare and the financial effects on Medicaid. We recognize that in government. There's also a personal effect on the patient, on the constituent who's had that fraud occur. And we're talking about hospice care, and you can't ignore that. As a physician, unfortunately, there were times when I had to put someone into hospice care, but realize when a patient is in hospice care and they're admitted to the hospital, they might not be eligible for more advanced or additional care because they're in hospice care, and they know they're in the terminal stages of life. Let's just say that inadvertently you've signed up or without any knowledge and you're placed in hospice care and you have chronic lung disease, you're hospitalized. You might not be eligible for care that will sustain you or cure you or take you to that next level. So the impact is on the individual constituent, I often refer to them as my patients, the individual patient, and the impact is on government at large with the funding. That dual impact needs to be addressed. And right now, it's a whole of government approach. We have to all be able to get together and do this. You heard from Dr. Oz earlier. You know his concerted efforts. You know what we're doing on the Oversight Subcommittee of Energy and Commerce. You know what the senators' interests are as well. This is an opportunity to touch that third rail and talk about that fraud that's occurring in Medicaid and in Medicare.
I would say that it's really the executive branch that has to carry the lion's share of the load here. They have the personnel, they have the documents. Congress has allowed its oversight role to pretty well atrophy. Administrations, whether it's Republican or Democrat, whether Congress is controlled by Republican or Democrat, do not give up their secrets easily. I mean, they just don't. We have very little enforcement power. So we certainly have a role. We can provide a platform in hearings to highlight some of these things. But yeah, it's got to be all of us working together, but it's primarily a burden on the administration. The reason you need a Republican administration, Trump administration will actually be concerned about eliminating fraud. I can't imagine a Biden or some following Democrat administration would be.
Dr. Joyce, you mentioned additional hearings. In March, you heard from Kim Brandt from CMS. What did you learn from that hearing?
I think the Deputy Administrator really put a light on what had occurred with hospice care. And when we talked about the individual constituent being affected, she made it clear to us that not only is the fraudulent billing occurring, but oftentimes that their personal identity is stolen as well. They have given up their identity to the fraudsters. They have removed the ability for an individual's constituent to have that access to the health care they needed. She really was an excellent witness who put that responsibility, the contributions from the oversight in Congress with the administration to work together to solve these problems.
We've heard some downplay the amount of fraud in the Medicaid program. That was a talking point made a lot last year. They point to the Medicaid payment error rate measurement, or PERM. Is that really an accurate representation of fraud in the program?
It just shows you how out of control government is. What do we set it at, generally 6% now?
It'd be no higher than 3.
Okay, I think it started out 6 and went down, but we gave waivers in some states where it's higher.
Yes.
Okay, so no, it's actually a pretty sad joke. And let me take this: the difference between government and the private sector is in the private sector, if you are running a business that's overtaken by fraud, you're going to lose money, you're going to be out of business, and that fraud's going to end. Right? I mean, there's a discipline in the private sector. Government, there's not. Generally, if there's a lot of fraud in your program and you're not being effective, Congress's response generally is to give you more money. That's what's happened time and time again. So the fact that the federal government does not have to balance its budget, if it did, there'd be much greater discipline. Part of the problem, the reason states are supportive of and lobbied for, and we could not rein in some of this Medicaid fraud, is because Republican states are basing their budgets, balancing their budgets based on that fraud, the 9-to-1 match, the provider fees, provider taxes. And so we had Republican senators, we couldn't get the votes to, for example, just cap the 9-to-1 match. Do a better job in terms of reducing what we allowed in terms of provider fees and taxes. So that's just a sad fact. States look to the federal government, states have to balance their budget. Because the federal government doesn't, money just flows and there's just no pressure, there's no automatic financial control over stopping fraud, as there is, as I said, in the private sector. You go out of business, that fraud ends.
Dr. Joyce?
The PERM program is inadequate because fraudsters know how to submit these claims. And a PERM program will allow you to correct that claim if it's incorrect. But the fraudsters are submitting perfect claims. They're submitting claims because that's what they do. They're not seeing patients. They're not implementing care. They're actually very skilled at submitting claims that will probably totally evade the PERM oversight. I think we need more.
So earlier today, Administrator Oz discussed what the administration is doing to address fraud in government healthcare programs. President Trump established the Fraud Task Force led by Vice President Vance. What can Congress do to help eliminate fraud and keep states accountable to the American people who are funding these billion-dollar
I'll take that because I think we've already started with H.R. 1, with the big, beautiful bill, with the working families tax cut. We put in guardrails, simple things. I took care of Medicaid patients while I practiced medicine for 25 years. I served in South Central Pennsylvania. That's where my practice was. But there would be patients that came in from Pennsylvania, sometimes from Maryland, and they would pull out 2 Medicaid cards. Which one do you want to use? You have coverage from 2 different states. They are drawing down from both states. They are frauding the system. And in addition to that, in the One Big Beautiful Bill, we have the ability to look at the Social Security master death file. And look, if a claim is being submitted for someone who's dead, that is a fraudulent claim. It has to be stopped before that money goes out. In addition, and as a provider, looking at that same death file, if a provider is dead, we say dead men tell no tales. Well, doctors should submit no charges. And we have to be able to stop that. And that has to be routinely and really collated with the claims to make sure that the patient is alive and make sure that the physician or the provider who's submitting that is alive as well. These are simple fixes that are part of the One Big Beautiful Bill. This is a starting point. We need to do more. There's no question in my mind about that. And I think that our investigations will give us the guidance of what additional steps need to be taken.
I think the Congressional Budget Office said that that would save $17 billion by not allowing people to be enrolled in 2 states at the same time, which seems like common sense. Senator Johnson?
We've got a 3-word mission statement in my Senate office to help people. We do a great job in casework, but my task under that, to help people understand. So my role, particularly in oversight, is to expose the truth and convey it to the American public. One of the truths I was trying to expose during the One Big Beautiful Bill is the fact that in 2019, we spent $4.4 trillion. This year we'll spend well north of $7 trillion. Increased over 60% as our population's grown about 2%. It's completely unjustified. We weren't able to reel it in. It's no secret that I was not happy with the one opportunity we had in this Congress, in this administration, to return to a reasonable pre-pandemic level of spending. Again, if you want to prevent fraud, don't spend the money up front. Stop it before the money goes out the door. But we were completely inadequate in terms of what we did to rein back spending, address the legalized fraud as well as the legal fraud. It really starts exposing and making sure the American public understand exactly what's pulling off here. We haven't done a very good job of that.
Thank you. We mentioned the hospice fraud and then some of the fraud that was uncovered in Minnesota. And a lot of that was uncovered by citizen journalists or other constituents within the community. What are some of the steps that state leaders, journalists, and citizens can help with the effort to combat fraud in these programs?
I think it's something that I mentioned earlier. You try to teach constituents, and we have constituent services like the senator references, look at that explanation of benefits. They're lengthy, they can be confusing. There are simple things that constituents need to look at. Did I receive this service? Do I even know who the physician or provider's name is on this service? And did I receive this medical device? And if I did I even need that medical device? Education is part of it. It's part of constituent services. Everyone sees what we do in Washington from this room and the legislative side, but educating our patients is part of what we do. I represent 12 counties in South Central Pennsylvania. I travel to senior centers in all 12 of those, and I think that's a component of letting constituents know. We make them aware of senior fraud. They know not to answer phone calls from the IRS, but we need to talk to them about Medicare and Medicaid fraud.
So again, I mentioned I was trying to get us to a reasonable pre-pandemic level spending using my platform to do that. The only reason we're here having this conference, or whatever you call this, roundtable panel, talking about fraud is because of one citizen named Nick Shirley. The fact that he was smart enough to go around with his camera, because of his buddy David, who really uncovered this, right? But those two individuals that went around and exposed this in a way that resonated with people. People couldn't ignore. I mean, people ignored me. People ignored GAO reports. People ignore all this stuff, okay? Because we're just going on with our lives. We're whistling by the graveyard. But it was the genius of Nick Shirley going there with a camera, going to those leering centers, okay, and finding out, well, there aren't any children here. Well, it's pulling off, okay? So, no, individuals can make a big difference, but you got to be pretty smart, pretty unique in terms of how you do it. And that's a pretty unique situation. But again, we would not even be talking about this level of fraud were it not for Nick Shirley and David. Can't remember what his last name was.
Thank you. I want to thank both of you for being here today. This was a great discussion. Dr. Joyce, do you have any parting words?
I think the most important thing to realize from the Subcommittee of Oversight and Investigations on the House side is that we are taking an active approach of looking at the offenders and bringing that information together to make additional recommendations. I look forward to following up with you, Ryan, and having additional discussions as that information is brought forward.
Mayor Johnson?
Well, one of the things I got for my vote on the One Big Beautiful Bill was, and as a fiscal conservative, I hate to say this, but I got $100 million or OMB. OMB is Office of Management and Budget. I'm concerned they don't emphasize management enough. So working with Russ Vogt, I've hired a staffer to just really spearhead this efforts. So we really start in a fulsome way utilizing that management function of Office Management Budget. The first thing they're going to do is probably spend about $10 million on an AI system. But as we're digging into this, it's coming from the private sector. It is unbelievable what government doesn't do, how we don't consolidate financial information. You know, all these agencies are completely different, using legacy systems. And I asked Russ Vogt, how much money do we spend that flows through non-government organizations? Don't know. How much money is spent through grants? No, don't keep track of it. Again, I'm an accountant. You know, I ran business for 30 years. This isn't that difficult. You require each department, each agency. You have all kinds of disparate types of information, and all, every agency department is different. But in the end, it's financial information. So you come up with a consolidation. Here's how much you get in revenue. Here's your budget. Here's how much you spend. In the different kind of care. It shouldn't be that hard. So we've got 2.5+ years of using that $100 million wisely to set up systems in OMB that focus on management to provide us information, Congress, the American public, so we can more effectively manage, start eliminating this fraud, have AI identify it. Again, this should not be that difficult.
Thank you, Dr. Joyce. Thank you, Senator Johnson, for being here. Appreciate it.
Thank you.
Thank you, Senator. Good to be with you. Appreciate you.
I want to say one thing about Senator Johnson before he leaves. Senator Johnson does an incredible job of making sure that the problem is diagnosed. I've heard him talk about the analogy with how policy needs to be more like a business. Diagnose what the problem is, make sure you have a correct diagnosis before you think about what the solution to that problem is. And I think, Senator Johnson, really appreciate your leadership and the role you play in educating both your colleagues and the American public, and keep doing your great oversight work.
So let me just quit. I haven't given Paragon enough. The only reason we had a chance to do more on one big beautiful bill is like Aaron and all of those Paragon really understand. We also had foundation for accountability. We had a bunch of groups, but they came and they educated our conference, and they did a great job, because some of the stuff's complex, and they broke it down so we truly understood this. So a big shout out to Paragon and all the folks who educated Congress in terms of the abuse going on. But thank you very much.
Thank you, Senator Johnson. Thanks for being here. Thanks for all you do. All right, well, thank you to everyone for attending today's event. We're deeply grateful to Dr. Oz, Senator Johnson, and Representative Joyce for taking time out of their busy schedules to join us. I want to thank my Paragon colleagues, Ryan Long and Demetrius Kazukis, and the entire Paragon team that made this event possible. If today's conversation has sparked your interest, and I hope it has, I want to invite you to visit paragoninstitute.org. We've got a QR code up there. If you don't follow us on social media, take out your cell phone, take a picture of that QR code. Please follow us on social media. You will, at our paragoninstitute.org, you'll find a full body of our research aimed at improving American healthcare, empowering patients, and addressing the problematic incentives that underpin a lot of government healthcare programs. Thanks again for joining us today, and I wish everyone a safe journey home.